Hello everyone. As you all know, Docplexus is bringing clinically relevant presentations for your discussion. In this presentation, we will have a look at headache after lumbar puncture. It is the most common presentation most of the doctors face. So let's have a look at what lumbar puncture is. Lumbar puncture is also known as spinal tap. It is one of the most common diagnostic tests performed to investigate cerebrospinal fluid. Lumbar puncture is performed to diagnose central nervous system infections and subarachnoid hemorrhages. It is a common recommendation not to perform lumbar puncture in patients with elevated intracranial pressure. As we have already seen, headache after lumbar puncture is a common presentation in the patients who undergo lumbar puncture. It is also referred as PLPHA, that is post-lumbar puncture headache or post-dural puncture headache. It is the most common presentation and it can manifest immediately or up to 7 days, and it can last up to 14 days. Some of the definitions have been discussed widely, but the most accepted definition is it is a bilateral headache that develops within 7 days after lumbar puncture and disappears within 14 days. The headache worsens within 15 minutes of resuming upright position and disappears or suppresses within 30 minutes of resuming recumbent position. Some of the facts related to PLPHA. The most common reason which has been thought about PLPHA, it is a CSF leak through the dural rent as needle exceeds the rate of CSF production, resulting in a low CSF volume and pressure. Some of the risk factors associated with lumbar puncture are female gender, a prior history of headache, and age between 20 to 50 years. Bevel orientation perpendicular to the longitudinal fibers of the dura is also a common risk factor. Most of the PLPHA conditions, they are not aggravated to severe cases, but some complications do exist. These are occasional immobilization, seizures, and subdural hematoma. Most common clinical presentation of PLPHA are nausea, dizziness, incidents of vomiting, sometimes neck stiffness, visual changes, and another common presentation is also a tinnitus. As you all know, they are all associated with the central nervous system. There are certain prevention strategies which has been there for a long time, and they have already been discussed widely. Using higher needle gauge, that is 24 to 27 gauge needles, is most common practice in prevention of post-lumbar puncture headache. When CSF is retrieved, stylet reinsertion is also recommended. Another one recommendation, though not widely used, is using atraumatic needles. The treatment of post-lumbar puncture headache has been discussed widely. Some of the common treatments are bed rest and oral analgesic. Oral caffeine dose is also prescribed by some doctors. However, large-scale studies do not subscribe to this thought. Epidural blood patch in severe headaches is also a good treatment option. When these cases aggravate to moderate or severe headache, epidural blood patch can be applied. Epidural saline is less common compared to epidural blood patch, and it is thought to replenish the CSF volume in the spinal cord. Surgical intervention is hardly done in lumbar puncture headache. However, assessment is critical. If you'd like to have more information about how to manage post-lumbar puncture headaches, there are several resources available. Some of these resources are accessible and well accepted. In a constant effort to provide you with the best clinical knowledge, Docplexus is creating more videos regarding your practice. Please subscribe us on YouTube or follow us on Facebook and watch all our videos. Thank you.